Ready to transform your hairline and thereby your personality? Let us discuss how we do it by best hair transplant methods today. But before we dive into it, let us know what is the latest in the field of hair transplant. It's Peak AI feature of Saraswat Hospital app. If you want to know how you will look after your hair transplant surgery, even before undergoing surgery, download the app and I'll tell you in the middle of this video what all things you can do and how you can find out about your most probable results after your hair transplant. But let us first see the transformation of today's patient. Today's patient had baldness for 4 to 6 years. There was a history of baldness with the father also. Also, he did not take any medication before he came to us for consultation. When he came to us, he told us that he wants to fix his hairline and probably increase the volume of the hair, not only in the front, but also a region of mid-scalp, so that he can have volume of hair to comb and have a hairstyle. The first thing first, we did a trichoscopy for him. The trichoscopic findings you will now see on your screen. At the donor area, the average diameter of hair was 0.075 millimeters, which is a decent enough diameter for hair transplant. The density, it was around 80 per centimeter square, such that we could easily take the required number of grafts. The coverage value at the back at the donor area was 12.10, which is good enough. In the recipient side, the area which required transplantation was 61 centimeter square. We wanted to give him a density of 35 grafts per centimeter square, and so we required around 2100 grafts. So as you see in the picture, not only we wanted to graft in the both left and side bald areas, but we wanted to improve or strengthen his frontal hairline as well as a part of mid-scalp. We would appreciate that you like this video so that we can bring you more such informative videos. On the day of his procedure, when he came with a good breakfast because we had already told him, we gave him a good hairline. After the doctor and the patient both agreed on this hairline, we took him for slit making. After giving the local anesthesia in a ring fashion, we made the slits first. After that, we harvested the grafts by a low torque, low RPM FUE machine so that the grafts were undamaged and we had good harvest of grafts. And our staff put the harvested grafts in the pre-made slits. After the completion of the surgery, medicines were given to him and all the post-op instructions were told him very clearly so that he understands. Phone numbers of our staff were given to him so that he can always call us and ask us for any help or support if required. If you have any questions regarding your hair transplant, you can comment below or you can WhatsApp us on the numbers here or you can call us for consultation. You can see here his transformation from before hair transplant surgery to 3 months and then 4 months result. Mind you that the results are only 4 months results, so a lot of hairs are still to come out. But look at his confidence. Look at the hairline he has now. The important points to see in this patient is, number one, the hairline is natural. It is soft. Secondly, the frontotemporal angles are not abrupt. They are rounded so that they are adjusted to the face of the patient, along with the frontal hairline, which is made as per the shape of the face of the patient. Please subscribe to this channel if you want to see more such educational or testimonial videos. And now, the exciting part of the video, the Peak AI feature of Saraswat Hospital's app. If you want to see how most probable results of your hair transplant would be, download the Saraswat Hospital app, click the Peak AI feature, upload your pictures, and then within 24 to 48 hours, you will get your photos as to how you would look after your hair transplant. These pictures would be reviewed by ABHRS, that is American Board of Hair Restoration Surgery diplomate doctors, which is me, Dr. Preeti Saraswat and Dr. Satya Saraswat, and then you will be told as to how you would look. Also, you will get a set of around 10 questions which will help you in your consultation with the hair transplant doctor. Also, you will get to see the approximate number of grafts required by you for your surgery. So what are the take-home messages from today's video? Number one, take the help of Peak AI app so that you know how many grafts you would require, what are the important points you should know before you undergo the surgery, what are the probable results you can opt for or you can look forward to after your surgery. Secondly, when you consult your doctor, always see for the credentials of the doctor. They should be at least American board certified hair transplant surgeons. Thirdly, you should see for long-term planning and assessment for your hair transplant. Because see, in this patient, he only wanted to strengthen his hairline and get a volume of hair in the mid-scalp. He has a lot of hair at the back, so it is our duty to tell him what all things he requires so that the hair at the back are there for a longer period of time. Otherwise, what will happen? The transplanted hair will be there, but the rate of losing hair towards the back, towards the crown would exceed the rate of growth of hair. So gradual thinning will come. So the doctor and the patient should sit down and have a detailed consultation regarding long-term hair restoration. Also see that best quality equipments and also the disposable tools are used for you so that you get best of all the worlds. Want to get some information or education regarding it? Please share this video with them. If you want to know about cost of hair transplant, please click the video on the left, and if you want to watch our latest hair transplant video, please click the link on the right.